Hey everyone, it's A Dog's Life with Angela Ardolino, and I'm excited about my guest today because I know that this is a problem that most dog owners deal with. Even cats, I'm sure too. Any animal's mouth we deal with this because I know with our CBD oil, telling people to put it on their gums, 9 times out of 10 people go, I can't get something in my dog's mouth. So when we have a dog that has problems with their teeth and they're old and they're rotting, this is something that we can do to help keep them healthy. And the best part about what I'm going to tell you is that, like most things I bring onto this show, it's natural. So we don't have to worry about getting a chemical in their water or spraying it in their mouth or having them chew on a chew that's just all manufactured products, chemicals put in a chew that they chew on. Not good for them. This is something that's all natural. And the best thing is that a scientist came up with it when her dog started to have problems. So I am going to welcome my guest, Dr. Emily Stein. Thank you so much for joining us today.
Pleasure to be here.
Yeah, I would love for you to tell everyone a little bit about your background and who you are, because it's so impressive. And then I love that you used that same science brain to go, okay, wait, I can help my dog with its issues. So tell us a little bit about yourself.
Yeah, sure. So I am a PhD in microbiology, which is, you've heard a lot about microbiology right now in the news. And I worked on how microbes respond to stress, such as antibiotics and antiseptics, and also nutrient stress, and how they work together to survive it, which is why we have a multi-drug resistance problem like you wouldn't believe right now. And then because of autoimmune disease runs in my family, I wanted to learn more about that. So after my PhD, I did a postdoc in rheumatology at Stanford. And actually, that's when I first started to take notice in the problems dealing with like oral hygiene and our struggles just in general after my grandmother had a stroke due to her poor oral hygiene. So that's how I first started getting into this about 11 years ago. And then once I rescued Tinsley, she was a 10-year-old Cocker Spaniel, and they warned me about her oral hygiene problems, and boy, did they under communicate how bad her breath was. But you know, within the first 36 to 48 hours after I rescued her, I had to make an emergency vet visit to get 21 teeth extracted, and she was on antibiotics for many months trying to clean up the rest of her body because the infection had spread from her mouth to her bloodstream.
Wow. And how did you know that it had spread?
Yeah, so there are some characteristic signs of distress for animals. And granted, she was a rescue, so she was already a little bit leery of me. But panting a lot is a really big sign. Drinking a lot of water, lethargy, so just laying around, not food motivated when normally she would eat anything. That's a good sign that there's a bigger problem underlying that you should pay attention to. And her breath was horrendous. And so a couple of her teeth were wiggly, and that's a sign that they need to come out.
Right. So you said she was 10 when you did this procedure. So if someone has a 10-year-old dog now, is that their only option, or are there other options now for them?
Well, luckily now, after the past 10 years, we've got a decent handle on the underlying disease. It's actually, so what gum disease in dogs and in humans is an infection deep below the gum line. So you can't brush it away. You can't dental chew it away. Vets can't even get down deep enough to where these microbes live to get them out. And from what we know, in a lot of chronic inflammatory diseases, which periodontal or gum disease is, you need to actually grow protective beneficial bacteria, because that will put the kibosh on this overactive immune response, which causes the tissue damage and that ligament to degrade, which makes teeth very loose and wiggly. And And so what we've come up with is a novel approach to actually grow beneficial protective bacteria in the mouths of humans and dogs. We're working on cats and horses right now, but it involves just nutrients and applying nutrient stress to the biofilm in the mouth, also called the oral microbiome, and that's the 360-degree microbes that inhabit the mouth, including viruses, fungus, protozoa, and bacteria. And so what we're doing is starving them globally of carbohydrates, just in the mouth, not in the lower GI tract, and encouraging them instead to start eating protein and breaking that down. And so what happens, actually, lucky enough, I have a really nice description. So this was like, I don't know if you can see that gross bacteria and fungus in the mouth of a dog before. Mm-hmm. This is 5 days later. There's hardly anything there. That's bad. So this is multi-drug resistant media. And so what we're doing is just shifting what the microbes eat, shutting off carbohydrate, turning on the ability to eat protein instead, which is actually very compatible with meal plans for a lot of dogs these days. And that actually changes who lives in the mouth. And that winds up growing a healthier microbiome over time. And rapidly, actually, much more rapidly than an antibiotic approach or an antiseptic approach, which current oral and dental products have on the market. Mm-hmm. So they like carpet bomb the dog's mouth with the hope that it'll help with dental hygiene, and it just doesn't. It doesn't work. It's just not working. I mean, over 80% of dogs. I was just talking to a vet dentist this past week. You know, textbook is 80% of dogs have periodontal disease. Now it seems as though the majority of dogs might have it, and younger than just age 3. And a lot of that is due to food, and the dental treats that are on the market aren't really dental.
Right. And I mean, that's one of the reasons I have this show is, you know, not only am I in the cannabis industry for pets, but I also own a boarding and grooming facility. And I have used the statistic, 75% of all dogs that come into my shop are ill, are sick, whether it be their mouth, or I can tell their gut microbiome is completely off. Mm-hmm. And it's mind blowing how many dogs are sick, and then they're just getting sicker and worse, which is one of the reasons why I created my company. But it's true. You know, we add teeth brushing as part of our services, and what we see is unbelievable. Mm-hmm. So I'm very excited to learn what this is. And, you know, this is something that if we're taking care of, you know, we always talk about how, you know, CBD medicine is wonderful because it's going to get rid of the pain and get rid of inflammation, but we have to find the root of the problem and take care of the root of the problem. Yeah. And we always talk about getting the gut in balance. So getting the gut in balance sounds like it's just as important to get that mouth in balance, and that the best way to do it is what you're talking about, because it's a natural process. We're not adding any chemicals. One of the things that always freaks me out is that we tell people to apply cannabis medicine oil right onto their gums. And when I think about the chemicals and things that are out there on owning a business that we are offered to clean dogs' teeth with, and I think all of those chemicals get right absorbed into their gums just like medicine does. It's true. So I know what a problem this is and how it's an issue. And at my rescue, most of my dogs are seniors, and even getting oil in their mouth is a nightmare. So having this option is a lifesaver. So thank you very much for you using your scientist brain to create something natural for our pets. I really appreciate it. So tell me about this product that you created. It's called Teef, T-E-E-F, which I love because I say that to my dog all the time. So I knew you were a dog person when I heard it was called Teef. Yeah. Tell me what's in it and how it works.
Yeah, so I just grabbed one off the shelf here, and it's very simple. It is a formula that's patented, human grade ingredients. There's only 4 of them. No fillers, no preservatives, because preservatives kill good bacteria that we're trying to grow. And it's a simple prebiotic powder. So comes in a little jar. This is a 30-day supply, so a little bit goes a long way. And I don't know if you can see this, but this is the measuring scoop. This
Tiny.
goes in the drinking water every day. And so the goal is to take these nutrients into the mouth of the dog and coat the surface, and it'll penetrate below the gum line where the bacteria will grab onto it. And the soluble fiber in it, called cyclodextrin, which is plant-derived, blocks the ability of bacteria to bring in carbohydrates. So they get globally starved of sugar. And then separately, we feed them vitamin B6 and the amino acid L-arginine, which is also derived from plant, to start their engine so that the good guys can start to really start to feed on that protein and eat that instead of the sugar. Because when bacteria eat sugar, they secrete acid, which is inflammatory and erodes the tissue below the gum line. And it also creates this inflammatory environment that really starts the gum disease process.
And we're talking about starches that can turn into sugar.
You got it. So chickpea, wheat, rice, that stuff is great for a gut microbiome, but for the mouth microbiome, it's actually very deleterious. And so this should just be part of everyday life for a dog and for humans, because our diets do have so many carbohydrates in them. So even on a raw diet, and this is what I have to tell people, is bone marrow has sugar in it, actually simpler sugar than the vegetable-based carbohydrates.
I was going to say, this sounds like it would be great for humans also. So this is it the same thing as the humans take? So our mouths are the same and it works the same way?
Yeah, so this is what I built for my grandmother. It's got the exact same ingredients, different ratio, because we have a little bit different needs than a dog from the microbiome's perspective, but the same concept and a lot of the same ingredients. Just the different ratio. And so fully consumable, non-toxic, kids, I built that for my grandmother. I'm on it. And we're actually adapting this version for Alzheimer's and dementia patients, because choking hazards for mint, they can still drink the water through end of life. So we're actually learning a lot from the dog product and adapting that back into senior care.
So a dog drinking it will get enough of it by drinking the water, even though you don't know how much water they're going to drink?
Yeah, and that honestly has been a learning curve for us, trying to figure out, because raw feeders don't drink as much water on a daily basis, because their food is wet, than kibble-based feeders, and then size is different. So surprisingly, in our studies over the past 5 years in dogs, a Chihuahua can oftentimes, or a Corgi or a Pug can have more bacteria in their mouths than a Great Dane. And so this single dose is actually very appropriate for small dogs as it is large dogs. And small dogs also don't drink as much water, and they don't make as much saliva, which kind of dilutes the toxins and things that the bacteria make when they eat carbohydrate. So a good goal, a rule of thumb is, ideally you want as much of that scoop being consumed on a daily basis as possible. And you know your dog best and what volume of water to provide to them.
So would you say that we should wash the water bowl every day, fill it fresh, put it in? And I have 11 dogs right now at my house, and 2 water bowls. Everybody's raw fed, but the water bowls last the entire day. Should I put more? Is that enough? Like, how do I know everybody's getting it? And is there an option of going ahead and putting it on the food?
Right. So first question, on average, and it can become expensive. So what we realize is, if you do have multiple dog dishes and multi-dog home, you know, you want to basically get as much of this in their mouths on a daily basis, and you won't see as speedy effects. Like literally, sometimes you can smell the difference in 3 days. Like you won't smell odor, or you'll start to see changes with a more full dose. And so by spreading it across multiple dogs' mouths, you're going to dilute that activity, which means it's going to take longer for it to work. It will work. You'll start to chip away at that change, just not as fast. And so from a cost savings perspective, since this is human grade and made in the US and it comes from premium, I can't get the cost lower than what I possibly can right now.
I hear you.
Yeah. And so what I recommend, just to save money, because, you know, I'm poor too, is just that scoop or 2 scoops, dump it in like a gallon of purified water, put it in the fridge, and you just keep on refilling the water dishes throughout the day. And that's the most cost-effective way we can come up with. The other way from a raw feeder standpoint is, you know, don't drink a lot of water. And sometimes now that the weather is warming up, ice cubes are a great thing. So you can actually fill an ice cube tray with teef water and they can get an ice cube.
Oh, that's a really cool idea. And I know that I have to separate dogs all the time. So I could also separate water dishes, especially for my seniors that have awful mouths, that I want to make sure that they really get it in there.
Yeah, that's the key. We've as far as you asked about the food. So the way dogs eat, they just woof it down. So it goes directly into their gut. And so you're going to wind up, this teef is going to wind up treating the lower gut microbiome, which is fine. It just won't do what it's supposed to do in the mouth. So we recommend putting it in the water. We are working, actually, that's why I'm in the lab right now during this coronavirus, is I'm working on a treat. That's actually a treat for the bacteria, not necessarily the dog, but it's got the same kind of an approach. So you can administer a food in combination with the water additive.
Oh, very cool. Because I do feel like there needs to be, with like at least 2 of the seniors I just adopted, something aggressively done. But I don't believe in putting a 15-year-old dog under and getting in her mouth. Both their mouths is really difficult. And so I can't wait to try this on them. And then we have to do a follow-up and find out, and I'll take pictures along the way. Yeah. But we're really good at, when we had to have cleaned them or do a deep clean when we first got them, you know, of course, got awful stuff off. But yeah, I can tell that there's stuff going on, and there's tooth loss, which I have any idea when it happened or why it happened. But yeah, we always start with, you know, getting rid of any pain or inflammation, fix the gut, and then the mouth is next. So I love that I'm being able to talk to you. And I want to go back to a little bit of your, you know, specialty and what you have researched, because I love the fact you have found 3 natural products that, you know, can fight and reduce inflammation. And one of them is a vitamin and the other one is an antioxidant. And, you know, these are a lot of the same components that we get to find in cannabis medicine. And your first ingredient is a plant-based product. So you can understand why I'm attracted to what you're doing, because it's just another step in it. You know, I turn to cannabis medicine the moment that there's pain involved. That is my go-to. I know that I have to stop the pain and get rid of the inflammation, and then I need to take the next step. And just the other day, one of my seniors, you know, had a bump here, and I was like, oh God, here we go. I knew I took too long or whatever I needed to do. And I immediately ran and put CBD. I usually put it on the gums, of course, but this time I made sure that it went on the tumor or whatever the lump is, because I could see it from underneath, and I did it from this way, and hoped that it wasn't a tooth, and it was gone by morning. So I think she got stung by something, because she's 15 and getting into everything now that she feels so good on a raw diet. But I know that I have to work on her mouth. So tell me more about inflammation and You said your grandmother had RA, rheumatoid
Mhm.
arthritis,
Yep.
which is how I found cannabis medicine, is I was
Mm.
diagnosed with RA. So
Oh,
I'm
really?
very interested
Hmm.
in this and the advice that you would give your grandmother to give to me. And I've seen these dogs all, if I read one more thing that says 9 in 10 dogs will
Mhm.
suffer from some sort of degenerative myelopathy.
Mhm.
And here I thought that was just something my one dog, my dog, my soul dog was suffering from. And then the more I adopt more seniors, I'm seeing the problems with them using their back legs, stop using their back legs, favor shaking,
Mhm.
dragging a paw, not even getting up, type of things. And then realize it is just another form of I can't say it, degeneration. So
Yep.
share some information with us of why you include those ingredients, and then what did you make for your grandma?
Yeah. So, a lot of autoimmune diseases actually have, so we think it's a three-legged stool. Your genetic predisposition,
Mhm.
um, environmental insults or previous infections, and then there is a microbial component, right? And so if any of those are out of whack, so the environmental and uh, component can drive metabolic changes, hormone changes, neuronal changes. That feeds into immune function, and you can cycle down. And normally, if you're really healthy in your microbiome can start to what's called tolerize, and keep your immune system tolerant and healthy. But if your immune system is screwed up, or your microbiome screwed up because you had an infection and you were put on antibiotics, or you're exposed to these constant insults of antiseptics, that becomes very difficult then for the microbiome because it's unhealthy. And so your immune system won't be regulated in the same way. And it's really important because we're realizing in microbiology that bacteria are secreting neuro and inflammatory or immune messaging and signaling molecules. And so there's this gut brain axis, and it's driving a lot of like neurosensitivity and hyperactivity of your immune system if you don't have a well-balanced, well-fed microbiome.
Very cool. So if I know, I kind of, the same process that I went through my animals I did with myself, because of course I didn't know what was wrong with me. So changing when I couldn't get any answers and was just being given prescription meds, I wanted to go, okay, well, I want to fix the problem or see what I can do about alleviating it. So of course, just like with my dogs, which I didn't make the correlation because I didn't even think about how dogs have the same issues as we do, is I changed my diet. I
Mm-hmm.
started journaling when I was having the issues and realized it was from what I was eating. Of course, I still have it. Stress and anxiety, makes a huge difference in it. But, getting rid of the pain, getting rid of the bad diet and the things that feed it make a huge difference.
Mm-hmm.
And so what did you make for your grandma?
Yeah, so I made this mint that she could suck on. She could no longer brush her teeth because she was from the older generation that would first had, when rheumatologists first treated autoimmune patients with gold, and that was toxic and it killed some people. My grandmother was one of those that did not. And so instead she tried chelation, she tried diet and aspects of that, which worked well to keep her going. But she did get some deformities, and that inhibited her from taking care of her mouth effectively. So this was an approach I built for her after her stroke, because her gum disease had progressed to where she needed a couple of teeth extracted, and the bacteria, they'll gain access to the bloodstream. And so in her case, they went up to the head, and other people, they go to the heart and cause valve problems or joint infections. And so I just didn't want her to have anything else bad happen to her. So that's why we came up with this approach.
Wow, I love that. That's an amazing thing. I appreciate your time today. Could you tell people where they can find more information, where to get the product, learn more about, because I know that you have wonderful illustrations and even a video.
Yes.
And it really explains and breaks it down a little bit for those of you that don't understand. But to put it in layman's terms, this is a powder that is completely natural and good for them, that will help keep their mouth healthy and help keep that bag bacteria away, so that we don't have to continue to put our dogs under to get these deep cleanings, which sometimes don't even address the problem or get the problem. So they're a waste of time and money. They cost anywhere. I mean, the cheapest I think I've seen is $300 to $700-800.
Yeah.
I've learned things about places, these places that are the vets, the groomer, the retailer, the doggy daycare. They kind of offer everything in one place that doctors get, or not doctors. The doctors aren't even doing it. The vets aren't even doing it. Techs are doing it, and they get money for the more teeth that they pull. Or they'll say one tooth needs to go, but once we have them under, if we find other bad teeth, we're going to pull them, and their dog comes back with no more teeth, which that story has been told to me so many times at the shop. It's unbelievable. So this is something we can do that is easy and all natural. So please tell people where they can find you.
Sure. So you guys can just go to teefhealth.com or Google Teef, and you'll find us.
Awesome. Thank you, Dr. Emily Stein. We appreciate you taking the time with us today. Have a great day.
Thank you. It's a pleasure.